Let's talk about the herpes zoster virus, also known as shingles. Shingles is caused by the reactivation of the varicella zoster virus that enters the body, usually as a child after a round of chickenpox or varicella infection. Varicella enters the body by the respiratory tract and spreads from the pharyngeal lymphoid tissue to circulating T lymphocytes. The virus eventually remains latent in the cranial and dorsal root ganglia for decades to develop the secondary infection of shingles. Incidence is very much correlated with the immune status of the individual. When the virus is reactivated, it replicates in cell bodies of neurons where virions are carried down the nerve to an area of skin intervened by the neuron. The symptoms can be seen in stages. The pre-eruptive stage involves painful skin sensations, headaches, and malaise for about 48 hours. The active eruptive stage involves vesicles that become painful and rupture, urate, and crust over with severe pain for about 2 to 4 weeks. Chronic infection is when there is recurrent pain for more than 4 weeks and up to 12 months. Doctors can diagnose shingles by pain and characteristic morphology and test for the virus by PCR and IgM antibody tests with the use of the patient's saliva or blood sample. The PCR test is the most reliable, fastest, easiest, and lowest risk for contamination. In this image, you can see a positive test result using the PCR test. The PCR test can detect the virus DNA in the saliva or the blood specimen. PCR stands for polymerase chain reactions. And here we have the fluorescent test that can be used to see if there's antibodies in the blood, which will glow in the cell. Treatment of shingles involves antiviral therapy, topical antibiotic creams, opioids, and topical lidocaine to all help decrease lesions and nerve pain. Transmission of the infection can be greatly reduced just by covering the lesions. For healthcare workers and visitors, airborne and contact precautions are needed for infections that have been widespread over the body, and secondary precautions are needed for only localized infections or ones where lesions have crusted over. Patients should be in their own single isolated rooms until the lesions are crusted over. Now let's discuss some ways to contain or eliminate infections. The number one thing to do is to be vaccinated either against the varicella virus or shingles. Springrex is a 2-dose vaccine recommended for adults 50 years or older that can prevent shingles, and it can be taken even if you had shingles or the varicella vaccine for chickenpox when you were younger. Hospitals can prevent infections and spread by alerting workers without immunity about risk and offer 2 doses of the varicella vaccine 4 to 6 weeks apart. They can also establish protocols and screening measures. Those that are exposed and not vaccinated while on duty are susceptible to the virus infection 8 to 21 days after exposure. They should leave work and isolate themselves and receive a post-exposure vaccine known as the varicella zoster immune globulin. Schools should also require vaccination for students before starting. The virus can also be eliminated like other viruses with the use of strong cleaning chemicals like bleach. Disinfection can reduce the number of viral microorganisms on surfaces from respiratory droplets or fomites from the skin.